Hello, students. In this chapter, you need to make sure you understand the key terms because some of these key terms will be on the test, such as your positions, like your dorsal recumbent position is the same as the supine, knee chest position, lithotomy position, and you need to understand the different instruments that you might see in a physical exam in order to assist the nurse or the doctor if ever by chance you get that opportunity. At least you'll know what these things are, such as the ophthalmoscope, the otoscope, the percussion hammer, those type of things. And all that's on your key terms. So let's move on here. All right, so physical exams basically are done to promote health, determine fitness for work, diagnose disease, and in nursing centers, residents usually have an exam at least once a year. So the doctor's going to come in and they're not all done at the same time. They're done, at different points in the year, but they are usually done at the facility. Hang on here a second. And then doctors and RNs are the ones who actually perform the exams. Okay. So just want to make sure I told you everything. Okay, so let's move on. Your role and the equipment. What you do depends on how you facilitate in the assistance. Really depends on the center's policies and procedures and the examiner's. So, you really might have to help, especially with positioning and getting the patient ready prior to or prior for the exam. So you need to know the following instruments, like a laryngeal mirror is used to examine the mouth, the teeth, and the throat. The nasal is a little instrument where they can flare open the nostril a little bit, and they use that to examine the inside of the nose. The ophthalmoscope, that's used to examine the eye. So ophtha is eye. Otto is for your ear. Otto is ear, and so your otoscope is there to examine the external ear and the eardrum. And the eardrum, the wonderful medical name for that is called the tympanic membrane. And then we have the percussion hammer. Sometimes it's called the reflex hammer. And basically, we use this to tap the body parts to test for neurological reflexes. A tuning fork is used to test hearing, and there's also a tuning fork that we use to test sensation. But for this point, all you have to know is what a tuning fork looks like. And I believe your book gives you, yes, gives you an example of what each looks like. Um, Vaginal speculum, of course, that's used to open the vagina to examine the vulva and the cervix itself. Let's see. Okay. Let me think. As far as your role goes, that really, like I said, it depends on the center's policies and procedures, but I mean, you could be there especially for positioning or maybe holding if they're doing a certain exam, they might have you hold a leg or a limb a certain way or hold the body over. It just depends on what they're doing. You might have to go and collect equipment and supplies. Again, you might be the one who prepares the room for the exam if they have an exam room. And some facilities do, some facilities don't. It just depends. Provide lighting. You might have to transport the person to and from the exam room. You may measure vital signs, weight, and height um, prior to the exam. Another thing that you would be important that you may do is draping the person because we only want to expose what we have to expose in order to maintain dignity. So draping the person and positioning them is really important, and a lot of times the assistants really do help in that area. You might label specimen containers. You might hand equipment over to the person who's doing the exam. You might have to clean the equipment or clean up after the exam's over with, so you're discarding used supplies. Usually after the exam, the doctor's moved on to he's out the door, and so we're there. We're going to have to help them dress or get back to a comfortable position. So, and then of course, if there's any soiled linens, we usually have to take those to the laundry room. So, uh, which I probably, here you go. So when you're preparing the patient, you have to really be sensitive to their feelings and their concerns. Because, you know, anytime you go for an exam, just like in anything, when it's an unknown, you have anxiety. If you know what's going to happen, you still have some anxiety. So the person is really, it needs to be prepared physically and mentally for the exam. Now, that's more the nurses and the doctor's job, but that doesn't mean that you can't be there to reinforce caring and reinforce, you know, if they might tell you something that they won't tell the nurse, and then you would have to relay that. Under OBRA, the person has the right to know who will do the exam, why it is being done, and what to expect. And they also have the right to personal choice, and they can refuse if they so wish. And so the exam is done only with the person's consent. So you need to underline that because that's an important aspect of any physical exam. The patient has the right to refuse, and so it's only done with their consent. Okay. So the doctor or the nurse tells the person about the exam, the reasons for the exam, who's going to be doing it, when it's going to be done, and basically about the procedure, what they're going to do. You know, um, privacy is protected, so the person should be screened. The room doors closed. Usually, they wear a hospital gown in case, you know, if they, I don't know, take a specimen, the person has an accident, whatever, you know, so that's easy to get to the body, to move around. The person is covered with a drape and only the part being examined is exposed. So that's, you know, it's important. Anytime you're going, and even in an exam, whether you're even preparing them, you need to make sure that you tell them when you're about to touch them. You know, it's always good, it's respectful to tell them when you're about to touch them, especially if it's someone who has dementia or maybe an unconscious person, because that's part of our job. Okay. Now you remember, you don't get the informed consent. The doctor or and the nurse do. Okay, here, let me fix this thing. Okay. So the person before the exam, they need to void. They need to urinate because an empty bladder lets the examiner feel the abdominal organs, and it also promotes comfort because you know you get up there on that, you're in a lithotomy position, you know, you got your feet up in the stirrups. This is the lithotomy position you get in when you go to the gynecologist. Okay, so you're going to have your legs up in your stirrups. That's not the time that you need to feel the urge to pee, because then you've got to get down, get dressed, go to the, you know, they usually don't have a bathroom right in the exam room. That means you would have to reclothe, go down the hall, and so forth. So basically, that's why they always ask you, do you need to feel like you need to void before you go into the exam room? So we need to ask the patient to empty the bladder, and if a urine specimen is needed, it's usually obtained at that point. And then we need to measure weight, height, and vital signs before the exam begins, and then, of course, draping and positioning the person for the exam. Now, weight and height are measured before the physical exam is done. And they're also weighed on admission to the center. And then the person is then weighed daily, weekly, or monthly, and that really depends on the person's nutritional status and why they're there, such as some certain diseases can cause you to hold water. So, and we can store water in a lot of different places. It just doesn't have to be at your ankles or legs or even in your hands. So, what we do is we weigh them. Okay, and you might have to weigh them every day, and you would do it the same time with the same clothing every day. So if they wore a gown when they got weighed and in their socks, that's what you would weigh them. And if you weighed them at 6 a.m. today, you need to weigh them at 6 a.m. tomorrow. So we try to keep that so it can be as consistent as possible, because your weight fluctuates during the day, just like your vital signs fluctuate during the day. Like your temperature is lowest in the morning, your blood pressure is lowest in the morning, it's highest in the afternoon, your blood pressure is highest in the afternoon, that type of thing. So we try to keep consistency here. So a standing, a chair, a bed, lift or wheelchair scales are all used. And of course, we just follow the manufacturer's instructions as far as operating those machines. Um, so remember the guidelines when you're weighing a person. You use the same scale, use only a gown or pajamas, and have the non-skid footwear or the shoes on. Now your book is going to say no footwear is worn, but if we have to get them up, we're going to be putting shoes on them, and we're not going to take them off to stand them on the thing on the scale. Now, if you have a bed that weighs them, it's wonderful, but still, you have to use the same scale that you've been using all along. You weigh at the same time every day. Before breakfast is the best. Have the person void first, balance the scale, and it should read 0 on a digital scale, and the weights on the um, like our weights that you've been practicing on, they need to they can be they need to be moved to 0 and balanced. So I think that's all we can say for height and weight. Um, Positioning and draping. Well, before you help the person assume and maintain the position, you need to explain why the position is needed, how to assume the position, how the body is draped for warmth and privacy, and how long to expect to stay in that position. And if you don't know, go in with someone who does know or ask for assistance on that first time so that they can assist you. Really, you should watch them perform it, and then you perform it with them there to help you, and then have them watch you one more time to critique you for anything on a third time. Um, but the positions that are commonly used are the dorsal recumbent, which you're lying supine, so you're laying on your back. The lithotomy position, that's with your feet up in the stirrups, so that basically the perineal and pelvic area is tilted back and it's looking up at you, and the knee chest position, so the anal area can be examined, and then the Sims position. Remember, the Sims position is a specific sideline position. It's on the left side, so it's a left sideline position, and it's again used for examination of the rectum or the rectal vaults. Uh, it's for like a colonoscopy. It's the way the bowel actually travels, and they would be in that position um, for that procedure. And also in the Sims position, you can also visualize the vagina. So if they, for some reason, they were kind of contracted in more of a fetal position, we might have to turn them over for the Sims position if the vaginal area had to be examined. All right, let's see here. When you're assisting with the exam, you might be asked either to prepare the person, position them, or drape them, or assist the doctor or the RN during the exam. And persons with dementia really may resist the examiner's efforts because they don't understand what's going on, and they can become agitated and aggressive because of that. When again, when it's unknown, you just they have to we have to work with our residents, and we have to try to explain to them. Let's see. The person's rights are always respected. If a person refuses or resists an exam, we don't try to restrain them or force them to have it. We try to coach them. We try to explain to them what's happening or what's going to be happening, that type of thing. If it, especially if it's something that's really important that needs to be done. But if they just resist or they refuse, well, it's their right. They don't have to have it. We have to try another route or something else different. Or sometimes it can be tried at another time. And sometimes we have to get a family member to assist as well. Usually it's their person that they're most connected with, or who really makes a lot of the decisions for them. Whoever that significant other is to them, that's the one we try to get to help us if we have someone who's not really giving us trouble, but they don't understand what's going on, and the exam needs to be done. And of course, the family, since talking about the family, the families are always informed. You know, we when the person comes into a facility, even alert and oriented person, we always ask them, who is your significant other? Who is the one you want us to call in case of an emergency or when you need something? And and they're pretty good about, giving you don't find too many people that just come into the facility and they are their lone alert oriented self. There's no one to call or anything like that. It just usually doesn't work that way. The doctor may order drugs to help the person relax because, some positions are hard to lay in, as well as some exams just aren't very comfortable. So the person's rights are always respected. That's the main point here. So when you're assisting the person after the exam, the person returns to their bed or wherever they want to go in the facility. And then the vaginal and anal areas are wiped or cleaned before the person dresses or returns to the room. If that area was examined or had something done there, because usually if there's an exam or a procedure, they've had to cleanse that area anyway, and a lot of times they're going to use some type of aseptic solution, and those solutions, if left on, can be quite irritating. And then, of course, it's wet, and wet feels uncomfortable. So we always clean that area before they dress and return to the room, especially betadine. Betadine is not only very irritating, it's very drying. So you don't want to leave that stuff on them. After the exam, you may also need to discard the disposable items, replace supplies, especially if you work in a doctor's office, you're going to be doing all of this. Clean reusable items, send the speculums to the supply area, or if they were disposable, they go in the proper receptacle. You'll have to cover the exam table with a clean draw sheet or paper and then label your specimens. Always label the specimens. Take them to the designated area with a requisition slip, and then, basically clean and straight your person's unit or exam room, and, follow the center policy for soiled linens. And then you have your quality of life because resident care is given in a way that promotes dignity, self-esteem, physical, mental, and social well-being. And remember, it's safety, 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 dignity. The person should know the reasons for the exam, how it's going to be done. They have to be informed, and only staff involved in that person's care need to know the reason for the exam and the results. Again, it's all about health information confidentiality. So if the person consents, the doctor tells the family, he a lot of times he explains it to the family too, and the person can share that information with whomever they want to, but we don't share that information with only those who need to know. Okay, this ends this particular chapter, chapter 27, and I will talk to you shortly.